Hail Maria, we need Christ to you.
Alright, good morning, all good listeners long Radio Maria, Papua New Guinea. Bring him Christ to come long you. Now long program lo Mipla, Health Ministry. Mipla got all sample very important guest here long talk about the World NTD Day. That is neglected tropical diseases. Alright, these all diseases mostly affecting more poor and remote communities. They can cause serious illness, disabilities, sometimes death, and many people were inside the Papua New Guinea, they are not aware of that disease. Okay, like I said, me mentioning Mipla got all important guest one time Mipla. Mipla got Abel Marome. He's the coordinator belong National Department of Health. Thank you long joining Mipla this morning. And Mipla got Rose Namah. She's the project assistant belong Japan International Cooperation Agency. Thank you, Rose Namah. And Mipla got Dr. Sarosh Jamil. He is the technical officer belong the World Health Organization. Thank you, Lord joining Mipla. And lastly, he is also a representative from the Japan International Cooperation Agency. He is the chief advisor. That is Dr. Masato Yamauchi. Thank you, Lord joining Mipla. All right, Miba, Pamipla start on Mr. Abel. You can go through and Mipla long discussion, Mipla. Thank you.
Thank you. The listeners belong all Radio Maria throughout the country. Radio Maria management. Lo give this opportunity. Lo mibla by total lo this neglected tropical diseases program. By me go inside lot of PCI English and then by me translate lo pidgin behind lyric. Thank you long all listeners. Okay, neglected tropical diseases are the group of communicable diseases that disproportionately affect the most marginalized communities, contributing to poverty and inequality. In Papua New Guinea, diseases such as lymphatic filariasis, yaws, scabies, leprosy, soil-transmitted helminthiasis, or trachoma, buruli-arsa, and dengue fever, there are about 10. We got 10 Savinchal of PNG. As different public health challenges. World NTD Day observed annually on 30th of January each year is a global platform to raise awareness, mobilize resources, and promote actions towards the control, elimination, and eradication of the NTDs. All the 22 provinces are affected by one or more of the NTDs. PNG observance of this day aligns with its commitment to achieving the Sustainable Development Goals, SDG 3, WHO's Roadmap for NTD 2021-2030, and National Health Plan 2021-2030. In the National Health Plan target states that we should end TB, HIV, malaria, and NTD, or neglected tropical diseases. There are 21 NTDs in the world, but of those, 11 are present here in PNG. During this World NTD Day, which we will officially officiate on the 30th of January 2026 at the Department of Health AUPI Center is to raise the awareness. Neglected tropical diseases are not often talked about, yet they affect thousands of people in PNG, all over PNG. But there are a few provinces in this country are burdened with these entities. The impacts on the communities, how do the entities have negative impact on the community? They cause a lot of disabilities, lifelong disabilities that disable them to participate well in the community. They are being marginalized. They are also being discriminated, so they cannot send their children to school, participate in the church activities and communities and so forth. So that is why we are bringing this awareness to the public in PNG so that individual can take responsibility. So neglected tropical diseases, mitok pinis, iga 22 pla inside the world, tasol mimi gati 11 pla. Na 11 pla emi half belong this plastic NTD. Na emi affecting all planting mana meri inside long country blayumi. Sig leprosy em 1 pla belong em. Sig yos, big pla swa, emi misalukim. Na lymphatic filariasis em 1 pla sig where em sa kosim elephantiasis or leg solap, an solap, or susu solap. Na alman meri no sa walk about good na participate inside lo wanem. Yumi got him 6 scabies. Plan this togo sem community service wege na plan the arab name but scabies emi 1 pla binatan em sa kosim. So mi pla 2 I got him bring him this awareness. Na mi pla bring him I got him some medicine where mi pla is how I give him. Na also sick work below me blah lo Department of Health long Toksawe. Now Alman Mary you can report you go long one map where health facilities all got long end. So all provinces now this la work long skin NTD me blah got him me blah got lo New Island province, me blah got lo West New Britain, East New Britain, AROB, lo NCD, Central, Gulf, Western Province. Na all Narla provinces by Mibla slowly moving out of them. So Mibla talks away also you got planned all services blow Mibla emi free. Now all Marcin blow Mibla to emi free. So all man many you yet to go na can find more this la Marcin lo one map where all facilities blow Mibla inside all these provinces. Now me call him long em. So one time this la I am Lara Mosem, this la honorable members of the team by all can come inside na make some talk behind by mixing na him go same. Thank you.
Alright, thank you, Mr. Abel. By me continue on time. Okay, by me continue on time. Dr. Sarosh Jamil is the technical officer belong WHO, World Health Organization. Thank you.
Thank you. Good morning, everyone who will join us today on this radio show. I would like to first thank Radio Maria for inviting us and giving this opportunity to talk about neglected tropical disease. Most of the listeners might be wondering why do we call it neglected tropical disease and what does it mean. It is not just one disease, it is a group of diseases categorized by World Health Organization, group of different conditions. These diseases, as already explained by Mr. Abel Marome before my talk, was these diseases are affecting people who are marginalized and are having not proper access to health services. As we know, Papua New Guinea, we are having geographical challenges, we are having logistical challenges for health services to reach, and people are not having proper knowledge and information of these diseases, and then in the absence of these factors, we are having these conditions in the population and community. So these diseases are group of diseases which usually occur in people who don't have access to proper sanitation, and their environment is not clean, and they don't have access to clean water, um, and also the breeding sites of mosquitoes, which can transmit those diseases. So these diseases are preventable, and if we have right information, if we have awareness, we can prevent this disease. So we take this opportunity on World NTD Day to disseminate this information, that who all are living in communities, in the villages, in the settlements. We need to be aware and mindful of the environment that we are living in. And if the disease happens, they have to seek care, and the care is available in the health facilities of National Department of Health and the provincial health system. So, if we talk about those diseases, lymphatic filariasis, it is spread by mosquito bite, the same mosquito that spreads malaria. What happens in this disease? The swelling, solap happens in the limbs or in the arms, any part of the body. It is caused by a parasite which is transmitted by the mosquito. So parasite live inside your body. So when the parasite is there, you are not able to do your normal work. You miss school, you miss work. You are not able to go to garden, and then you become sick. You become so sick that you cannot contribute in the family income, and your social life is also affected. We talk about yaws. Yaws is a ulcer, is like a sore, which affects children less than 15 years of age. If no treatment, then it might get bad during later time of the life and affect the joints and become very painful, and it destroys the bone. So these diseases are causing disability, and also lots of stigma among the people in the community. Leprosy, we talk about leprosy. Leprosy is very less in the number in this country. In year 2000, WHO declared leprosy to be eliminated in PNG on the national level, but the leprosy is still present in few high endemic provinces. So leprosy is still there. Still, it's like clustered groups in few communities, especially the communities which had leprosy previously. They still have it now. So seven provinces are still reporting leprosy out of 22, in spite of the national declaration of elimination. So these diseases are preventable. Leprosy, we have drugs available. It is caused by a bacteria which is spread same way as TB, by droplet infection and among close contacts. So if anybody is sick with leprosy, we need to put that person on treatment quickly, early as possible, so that disease is not spread in the community, in the family. So the program, the National Department of Health provides free medicine for leprosy. Leprosy treatment is for 6 months to 12 months, depending on the severity of cases, and that has to be a regular treatment. No, you cannot afford to interrupt the treatment. So once you take the full treatment, it is curable, 100% curable. But if you don't treat, it will affect the nerves and then disability for life. And once the nerves are affected, it cannot be treated back, cannot be made all right. So these are the conditions that we're talking about on this day, and we would request all the listeners to be mindful of these conditions, and also to seek medical care if they are suffering from these conditions. Thank you.
All right. Thank you, Mr. Jamil. I have a question. As leprosy is one of the most common, and I've read a lot about it in PNG especially, what are some signs or symptoms that people should look out for in themselves or in their children?
Thank you for the question. Leprosy is caused by a bacteria. So, and that bacteria is spread by droplet infection from one person to another. There is no mosquito, there is no animal involved, or any vector is involved in transmitting the disease. So, once that bacteria enters into the human body, the first symptom that occurs is a patch on the skin. That patch is having loss of sensation. So, if you are having a discoloration of skin, that means that color of the skin is lighter with the other healthy part of the skin, that patch will have little less sensory loss. So this can be even tested by self-examining by parents or by individuals themselves, that if they are having a patch which is not having itchiness, no scratching, no pain, and it is having less sense, then that is the first sign of leprosy. It starts with that patch. And then once that patch becomes big enough, it will affect the nerves below it, and then it will go inside, affecting the nerves. So that depending on the nerves, the symptoms will appear. For example, there is clawing of the hand, foot drop, there will be wrist drop, or they will be limping in the leg with a patch. So you can relate that, okay, the patch has caused the nerves being affected and the nerves resulting in the disability. And then there will be ulcers which are present in the sole or in the palm. That ulcers are non-healing ulcers, because what happens is the sensory power, the touch is absent in leprosy patients. So they cannot feel the pain if they are getting pricked by a thorn or being burnt by a hot vessel. They will not feel the pain, and they will keep on doing it, and then that results into ulcers. So we have to be mindful if we are seeing anyone in our families, or we are seeing in the community people who are having sensory loss in their palms or in their sole in the foot, and they are having ulcers. That can be also a leprosy. There are other features also leprosy, which starts right from the face up to the limbs. The features are loss of hair of eyebrows. The hairs fall off. Then there will be non-closure of the eyelids. They are not able to close their eyelids because the facial nerve is involved. There will be nose depression. The nose will be depressed. So all these features relate to the features of leprosy. Especially in the children, we have to be very careful with the patch and also with the nerve of the hands. The children whose nerves are affected will not be able to button their shirt. So because their nerves cannot be able to hold the buttons. So that's one of the very important signs. If anybody is seeing that the child is not able to button their shirt with their fingers, then that means the nerves are affected and can be leprosy. Yeah.
Thank you so much, Dr. Sarosh. All right, by me go one time narapla guest plomipla, Dr. Masato. Please continue.
Okay, good morning. Name Masato Yamauchi. I'm coming from Japan, JICA, Japan International Corporation Industry. And Mr. Marome and Dr. Sarosh explained me all get something. So, okay, let me talk on them program from JICA. So, JICA supporting lymphatic paralysis program. So, we call him JICA project for elimination of lymphatic paralysis. So, program bro PNG taso no ga global program all get country conducting this program all get one kind of thing. Then Pira supporting this program, for example, Pira providing financial support, and also one of the marathon company ASI donating one Pira marathon for lymphatic paralysis. Then, so as explaining lymphatic paralysis, one infectious disease carried by mosquito. That's all the time. Mr. from the village and place, some place and call him because of masalai or kind of thing. But sick that's all. Some in a preventing this disease or just kissing marathon. Then sometimes we are conducting one big campaign, master administration. Then time we are province. Then we are giving the marathon all the people from province. Then please time we are come province. Please kissing marathon. Please come the booth na kissing marathon. So that if you are in Karim Discapina Tango lymphatic paralysis. Then what else? Okay, so JICA work one time NDOH WHO very closely. Then looking the real situation, then reporting Japanese government. Then Hammasro supporting this project na PNG. Okay, if you work one time na you this sick lymphatic paralysis na NTDs no PNG.
Thank you.
All right, thank you, Dr. Masato. When we go long short break, get ourselves together, and then we come back in, we'll continue with our program. We'll start off with Miss Rose Namah. Thank you.
Thank you.
welcome back, all good listeners to Radio Maria. Thank you for tuning in to the program Blomipla today, our health ministries. All, as I've mentioned in Pinis, all representatives Blomipla, one pla from the World Health Organization, two pla from JICA, that's Japan International Cooperative Agency, na one pla from the National Department of Health. Thank you all for joining me this morning. Okay, Miss Mipla Tok Pinis, Mipla Tok Law World NCD Day, we're all here law, making awareness to let the people know, the public knows. This is something that needs to be talked about, and usetol no save long, and please put him yaw and you are him spreading news. And if you'd like to ask a question, you feeling Muslim, you need him answers now yet, you can call him Mipla Lobby Mobile Blomipla 75 307272 or our Digicel, that is 711-27238. Alright, thank you. By me continue on time program Blomipla. We'll start off with Miss Rose Namah. Thank you. Alright, yes. Enough you talking Mipla and the listeners Blomipla, those who are joining us live on YouTube also. Talking Mipla, one example work where government and JICA were working in terms of this NTD.
Okay, thank you. Lo good pla asking bla you. Na good pla morning lo listeners bla Mama Maria Radio. Okay, all sample activities where me pla work lo making lo addressing neglected tropical disease and we got two pla. One pla and me plus running all training or facility all workman belong all health centers inside one all provinces long and me plus call him neglected skin tropical diseases. And all sample disease where all narapla one walkie to finish them all same scabies na yos na all narapla sick, but you got narapla big pla major activity me plus I make him mass drug administration, where big pla program through na save involving big pla budget. Na me plus go inside lo one all province, you got three pla province me pla making pinis. Lloyd New Island province me plus starting na two pla time long 2 pla year me plus I give him all treatment. 3 pla different kind marasin me plus I give him. Me plus I give him ivermectin, DEC, na albendazole, all snake marasin. Na this lol marasin also have targeting all sick, also yos, lymphatic filariasis, trachoma, all this last sick. Now also me plus I help out to long screen him or look out lol sick man where he got narapla sick also leprosy, na bruli ulcer, na all this la kind of sick. Lo refer him all by cam lo big plow sick lo kisem gurale him. Inside lo mass drug administration, aim long give him this lamarasin, aim long reduce him or interrupt him transmission blood this lo binatan where mosquito sa karimigo. Time binatan is inside lo man na mosquito kam kage this laman em go long every meal blong em na bite him narapla where inogat him this la binatan. Save pass him or transmit him go long. This like 80%. So work play MDA, me plus save give him, lo stop him or interrupt him this like transmission no can come up. So time me play save give him, me plus target him 95% long. Entire population 5% and me play at sample exclusion criteria inside of this like activity also bell mama, manems lapun all geta all pigini anit lo 2 years old. Also mama got bell. Na all breastfeeding mothers were pigini stop anit lo 1 pla muna
7 days
or 7 pla day no go down. Em all no sekisim this la marasin. But otherwise 95% na me plus go right down to the remotest part long. This la province where Karino naplo go Balusa I go down or Walkman Mary Blau 6 Save go inside. So what me plus I make him WHO World Health Organization, one time JICA, tupla WHO was a technical partner, help him mipla lo give him ting na. So him mipla wrote lo how lo make him this work. JICA come in lo site lo funding, WHO too sa come into lo site lo funding, assist him all provincial health authorities. Mani sa Goran Strait lo province na mipla sa train him all workman merib lo one all health centers, so all by lookout in one all catchment areas belong all. So this la program expensive, but very effective. Inside long New Ireland province, mipla make him lukose province free. Mipla go run him sample survey so him all same. Now all people, all man marry blow New Ireland province, got mo binatan way by giving this la sick blow lymphatic filariasis. Mipla okim tu la rabaul, mipla run him survey, got triple place, he got binatan yet, mipla focus straight long all, it's la triple place, mipla pinisim wante marasin lo, this la year, last year. Mipla yokim to lo West New Britain, mipla running first na second round pinis, all two by going inside lo survey or surveillance lo. Looking binatan him stop yet, or mipla activity blo Mestrag administration, he complete him na, he stop him, or binatan pinis or no god. Mipla now this year, mipla by focus long West Epic province. So mipla you go lo provinces where he been got mapping pinis long na. Study so him all same above lo 1% according lo guideline lo WHO. O said province you above you got binatan more lo 1% requiring Mestrag administration. So one time this la report mipla you go lo this lo province where you got him this la survey or this la mapping pinis long all workman mirits go inside and we can mipla also lusting till acknowledge him all good la partners plo mipla all same the leprosy mission PNG too all stop inside one time mipla long this la fight na PNG IMR all Institute of Medical Research and all narapla partners mipla work bung one time and also provincial health authorities blo this la one all provinces where map or study is showing pinis all same only got team this la binatan na needing Mestrag administration lo go inside lo interrupt him transmission blow this blow all sick. Yeah, that's
Thank you, Miss Rose. Alright, I must plenty work straight you block law can stop. Alright, one of more sample challenges that still remain towards this journey or this about controlling eliminating this all diseases.
Okay.
Your colleague can answer that.
Yeah. Okay. Okay. So yes, we are facing a lot of challenges actually. Okay. Okay. Albania has made a great strides in the address NTDs through the initiative like mass drug administration, Ms. Rose explained, and for the lymphatic paralysis and yours in these three provinces, New Ireland province, and East New Britain and West New Britain province. And also the increased focus on the integrating NTD service, not only the one disease, we are integrating all of NTDs and also other programs as well. The Skin NTD program, this is one of our program, has managing to reach 7 provinces and diagnosing drugs reaching health facilities. So prevention of leprosy is being done by single dose rifampicin administration to close contact of positive cases, and the resulted in reducing disease transmission and burden. However, challenges remain, including difficult terrain, limited healthcare infrastructure, limited financial, and the needs more trained health workers. Additionally, raising awareness and ensuring communities are fully engaged in these efforts are critical to sustain this program. So we have to continue this program, not only once, so we have to continue in the future. That's one of the challenges.
Thank you.
Another challenge.
All right, yes, thank you.
Okay, thank you. From the National Department of Health, the challenges remain the limited resources. The government has given little money compared to the magnitude of the problem that we have. Like, we have 11 diseases under one program, but the resources are always limited, both at the national level and at the provincial level. The second thing is the hard to reach populations. Like PNG is a very vast, land mass, and a few places like West New Britain that they just discussed, and then Western Province we have Sundown. There are so many provinces that are very hard to reach, so it's very expensive to control and contain those diseases. So we need to put in a lot of efforts and resources to see that. The other thing about the supplies, medical supplies. In PNG, there is always an issue of medicines not reaching the people. It's another challenge that our NTD program is also facing, but we are very thankful that WHO has procured those medicines for us with JICA. And the distributions are done accordingly by Leprosy Mission PNG. So our medicines, we want to make sure and ensure that they are available at the site of the point of care, at a facility where people meet the health services. And surveillance is one thing. Surveillance is like, you have to look out for those diseases. If they come around, people have to come for the services. And when we find them quickly and we treat them, we prevent two things. One is the prevention of the disability, and the second thing is the prevention of the disease itself, contain the transmission. But if people are not coming, then they continue to transmit, and disease continues. So surveillance is also very important, but it's a very huge challenge in PNG as well that we are working to address those. Thank you.
Thank you, Mr. Abel. Anyone that you'd like to say something along that?
Yes, I would like to add on the role of the communities in preventing and also fighting these diseases. The community can take a very active part, and we would request the community to take up the ownership of these diseases when they see it in their community or the suffering in their family. They have to seek the care from the health system. So the communities here are simple actions like whenever there is mass drug administration. So community should participate and should take the opportunity and should help in increasing the consumption of the drugs so that everyone gets protected and the transmission is stopped. Also, the community can work in practicing good hygiene when in the environment, because health as such depends on on three factors of agent, host, and environment. So the host is the people living in the community, and the environment is the surrounding, and the agent is the pathogen that is causing the disease. So the community can look into the environment part, that is hygiene and reducing the exposure to those pathogens and disease-causing agents into their environment. Families can also support those people who are affected by showing compassion and being empathetic to them and not stigmatizing them or not pushing them away. The society can accept and try to help those people who are suffering from disease to seek the treatment, encourage this to complete the treatment. We have observed that in few communities, when they don't have cure or proper awareness, access to the cure or proper awareness, then they try to stigmatize the patient and maybe try to keep him away from their houses and put them in separate places. And we have even heard about practices like witchcraft and other things that is associated with these diseases, because the rural people, don't have the proper information. So they attribute these conditions associated with witchcraft or some magical cause, which is not true. So the community has to be aware and try to accept these diseases as a disease, as a medical condition which can be cured. So this is one of the important things communities can do here in PNG. Yeah.
Right, thank you, Dr. Sarosh. I have a question. Okay, so some communities, when others, when like JICA or the health of workers, when they go to give awareness and or say that oh, there's a disease and something like that, some of them they don't. Yeah, they'll ask questions or they'll be like, "Eh, why make you say me no basic?" Something like that. So why is it important for everyone to take the medicine during mass drug campaigns, even if they feel healthy?
So yeah, that's a very, very valid question, and we have faced this question many times when we have gone into doing MDA. So mass drug administration is a intervention which is defined as treating everyone irrespective of their infection status. So irrespective of it. So these are preventive drugs, preventive chemotherapy drugs. So if you take the drugs, since we are doing a public health intervention, it is not possible to test everyone before treating. It is not possible. So if we are talking about PNG, there are 6 million people who are requiring mass drug administration. So how will you test 6 million people? You cannot. So what you can do is to give them a safe, a good preventive drug, so that even if they are suffering or they are not having those pathogens, the drugs won't harm them. So drugs will not cause any problem to them, but the drugs will kill the disease which is not known, which is not tested. So it has like a two effect. So it is always safe to take the drug rather than being sorry of not taking the drug and suffering from the disease later in life. So we tell them that the drugs are safe. It is only one time they have to take, and if they don't take and everybody around them takes, so they are the one who will suffer from the disease because others are protected and that person is not. So they have to take, that's more important. So anybody who is left behind can have those diseases later in life. So we give this information, and then we have seen the coverage increasing from mass drug administration with this information.
Thank you. I mean, prevention is better than cure.
Cure,
as
that's the
health workers would know.
yes.
Sorry, I
yes.
just add on, elaborate a bit on what Dr. said,
Thank you.
especially when people are refusing to take drugs. Before we conduct mass drug administration, there's a part in the program that is social mobilization. We do awareness and we advocate and try to make people understand the importance of them taking the drugs. So we have health workers who are the local people at the given areas. They, translate in their local notoples. Also, tram notoples, tanim tok make sure that all man Mary must understand him good. When him benefit or by kiss him, suppose only drink him this lamarasin. So, no good awareness ago, yes, it's a god this lakain. It's a someplace a kickback also one him. And our plus strategy too, me plus a UC mem. Me plus workman myriad sa drink pass la iblongol. So
I
me
would
play
recommend
drinking pass la iblongol now. I'm saying, convince him all long okay. Only drinking plenty marasin and triple drugs there. And mark 10 to 12, 15 pla, you can down him one per time here. Now all by poret la kisim, but I'm also looking one pla workman Mary pla hausiki drink pass. Now only observe him or say, no, I didn't drink plenty marasin, I'm not die.
No bad side effects.
No bad side effects. So me pla to masigo na kisim. So I'm sample strategies me pla say, you seem long time me pla lagi marasin. Number one, olet must stop place. Local dialect belong all long. All man Mary must understand him. Nol poretet Ogman Mary Blausiket must drink pass. So all me play make him the triple provinces pinis na me play reach him this la target percentage or on him WHO like him la coverage percentage me play achieve him.
That's right. You talk na meeting maybe in one pla. It is in probably one of challenges that you plus are facing. On them thinking kind of they are aware of polio disease. Time all either Red Cross or UNICEF or settle Karim like all go inside lo give him the vaccination. They are already lo kissing. But this common distal diseases that Mipla mentioned and the name says itself, neglected diseases and something that it is common but people are not aware of it. They are ignorant to it, something like that.
Right.
Okay, and if you would like to say something, thank you.
For the MDA addresses 5 pla siko gata. One blood soul. LF prime one me blood slab but inside longan karma sick trachoma. Trachoma bla blinding sick. All money got also I got him cataract low eye now also looking good. So recently WHO declaring elimination already but still he got in this plus stop. So Marcin will give him address in this la. Number 2. Number 3, we'll call him STH, soil transmitted helminthiasis, also worms, so stop in Salobel, Nakagay, Mikagay, Sarosh, all pinini, Sarosh, all pinini, grow good, Nakano Sama. And one idea where 2M Karma Mintalos Lamarcin will give him. Now, Blasig, Scabies, Imelukim, Ivermectin, and we'll give him Emblo cleaning.
I don't care.
I don't care.
I don't care.
Community service, Emodisla, address him. Now, last one, yours. Yours, the big plastic inside the country where we reported the highest number in the Western Pacific region. In the world. 100,000 cases plus yours. Yours, on the soa, big soa, sablo here, lo mouse, by looking him sablong, lo damlo, lo leg, lo pinini, kind of some. So, now I'm salo, the mostly. Now, one blood dose blood is la maracin or call him azithromycin, one dose penis. Now, plenty old maracin blomibla long NTD program state dose. Na state something. Giving one blood time penis. Except leprositazole can take him 6 to 12 months depend. So MDA very cost effective because ME address him plenty sick until one blood time. So I got 5 pla. 5 pla ogata one diseases address him. So I'm very cost effective na good intervention me take him. In Charlottesville too, me got him all interventions. He got 2 pla, 1 pla, me must find him all this like case na treat him. Na me must find him all context na me must treat him. Because this la yours you treat him, money got yours, but you must also treat him over the entire household. Because them pass on from the ML or Warablong, Swa, Golonarbla. So whoever lives in the same house, chances of them getting it is much, much higher. So that is where we are aggressively looking for those cases and we are treating them, but we must also treat the context. So we got 2 bla intervention, 1 bla find the case and treat, and find the context and treat. But Mass Drug Administration covers the entire population, addresses 5 diseases. I'm very cost effective intervention. We will take him in PNG. So we are slowly moving out to cover more provinces within the next couple of years, which Sundown will be this year, ECP maybe a year later or so, and then Western Province will be the next. So these are the 3 provinces that we are expanding on the Mass Drug Administration. So we are working very hard, though we have so many limitations, resource constraints, but we are trying our best to do what we can do. But we need the support from everybody. Thank you.
Thank you, Mr. Abel. Sorry, you talk yours. The picture scares me. Okay. Is it same as ulcer or?
Tropical ulcer. One kind of tropical ulcer. I got plenty of different sources. I think you'll poster by looking.
Okay.
We put it in the poster already, so that poster is there. I mean, you guys are also on YouTube now or others.
Yes.
We can always share with you those pictures. you can also upload and describe them, which will also assist a lot of people to understand the different source that we have. It's not only yours, there are so many other, but we also have the test kits to test for yours and confirm. Yeah.
Thank you, Mr. Abel. All right. We'll just wrap it up, and I'll probably go with the last question and then give some more talks on it, and then we'll finish. Okay. On this World NCD Day, what message would you like to share with the people of Papua New Guinea, policymakers, and our partners to ensure we can overcome these diseases together?
Okay, thank you. On the World NTD Day theme, it says unite, act, eliminate. So what we are doing today, we are bringing the awareness to the people, to the policymakers, and to the partners who are supporting this entity in PNG to unite. We all come together, put our resources together, and we act together so that we can eliminate those diseases. So in PNG, we have those 11 entities which are present, at least one in every province, and in few other provinces that we are targeting our programs, they have at least 5 or more entities. That's where our focus are. We have, the government has already put into the National Health Plan 2021-2030. It's a 10-year plan that addresses the TB, HIV, malaria pandemic, but also NTD is part of that. Secondly, we have already a structure that is already at the Department of Health, where NTD becomes one of those communicable diseases program now for the first time in the history of the National Health Plan, which is something good for us. Following that, we also have a National Strategic Plan for Neglected Tropical Diseases that is already in place. So using this term, strategic plan, we are coming up with interventions. And interventions, number one is intensified disease management. So we have to find those cases wherever they are, whether through the routine health system or whether we go out actively and look for them and put them on a medicine. The second intervention that we are doing today is to find all the contexts. So in order for us to control any disease, we must treat the cause and then treat the context, and we stop that. So these are the interventions, but there are others like vector control, malaria control program. They address like lymphatic filariasis, dengue fever. It comes under that, but we are looking after the program. WAS, water, sanitation, and hygiene. We have to create a healthy environment so that diseases will not be in the community or in the environment. And the last one is what they call a One Health. When we talk about One Health, it talks about the environment, which is where we are living, we are interacting with one another. That's the environment. And then we have the human. Humans are all of us. So the diseases can come from the environment into the human, from the human to another human. And then we have animals. There are other diseases that can be transmitted by animals and so. This is some of the approach that the government is taking. And from this point, we have the drugs available. Okay, we have NTD drugs. We have azithromycin. We have to treat yaws and trachoma. One drug can treat both, but all other sources. And then we have ivermectin. It's also a parasitic infection, and we can treat worms or nerve malaria, but also it can also treat scabies. It's a very good medicine for scabies. One dose, very effective. Then we have permethrin for the scabies on the body. They can apply. And then we have MDT, leprosy drugs. It's always available, distributed on time to where the diseases are. And we also have a clarithromycin. Is another drug that is already available in PNG, in good stock, and it's for Brule ulcer. We also have a loose dose rifampicin for Brule ulcer, but also for preventive therapy for leprosy, those who were infected with leprosy as well. And we have DEC for the lymphatic filariasis program. And then we have albendazole. Also, we have rapid test, diagnostic test for yours, and also DPP. There's a confirmatory test for yours, also available in PNG. We have distributed. So this is the effort we are putting in. Although we have a lot of limitations, like I mentioned, hard to reach communities, reduced resources, all that, but we are trying our best, and we are doing our best. And we need a good support from everybody. And I would like to take this time also to thank Radio Maria also for allowing us to come and air our views. And we would be able to work with you. So in the next program, when we come, we will talk about the disease specific. Now we are generally talking about the government approach, what we do, our partners are coming. But in the subsequent programs, if you allow us, we will talk about disease specific. What is yours? What is leprosy? What is scabies? And all that we can discuss for the benefit of our listeners out there in the community. So I think that's basically what it is.
Yep.
Thank you, Mr. Abel. Thank you all for your time. Okay, me just reminding my listeners, we plot the topic of discussion today on the World NCD Day. We plan making awareness. They are doing the awareness. NCD, like Mipagora Toktopinis, neglected tropical diseases is a group of 21 different conditions that can cause significant disfigurement, disability, and eventually can lead into death. All right, thank you all for your time. Thank you, Mr. Abel Marome, the coordinator of the National Health Department. Rose Namah, she's the project assistant for JICA. Dr. Sarosh Jamil, he's the technical officer of the World Health Organization. And Miss Rose, one of her colleagues, Mr. Dr. Masato Yamauchi. He is the chief advisor, project for elimination of lymphatic filariasis. Scientific terms, please bear with me. Thank you. Thank you all for your time, and thank you all to our listeners too, for those of us joining us on YouTube. Suppose you got any questions that you'd like to ask, you can call us or text us Lobby Mobile Blomi Plus 75303 307272 or Digicel Blomi Plus 711-27238. Thank you.
Thank you.
Thank you.